Did you yourself experience any discrimination?
There were definitely, maybe not directly against me because many people didn't know what I was, my cultural background. However, with patients, yes, there were the way they were being treated or spoke about in reports and stuff like that. So I did speak out against that many, many times. And the nurses were so shocked to hear that I was Métis because they thought I was Hispanic or some other culture.
So what kind of comments would they make in reports?
Well, I'm not going to say a lot because of
Privacy.
yes. Okay, so some things in report was when they would say the name and then they would say he's a native man or a native lady. And so I would say, oh, that's interesting. So, and this is in a room full of nurses, and I would say, that's interesting. So why don't you address the other patients that we have here as German or French or Ukrainian or whatever? I said, why do you have to say that in the report of describing who this patient is? And they were just like, they didn't realize, some of them said they didn't realize how they were addressing those patients. And so I did write into management as well and to the administration and just asking them that this is not right, that something has to be sent out about respect for our culture. Well, all I have to say is I really would like to continue mentoring as many nurses. I do work with more Native nurses now, which is so
Here in
very
Edmonton?
in Edmonton. Yeah. Yes, Métis or status in all of the areas that I'm currently working at. So I always say positive and proud things to them, that I'm so happy and excited that they're in this profession, because it's in many respects you can help your own people, like back in the communities, your families, to help them better understand, or even if a lot of our older generation does not understand a lot of this medical terminology or disease processes that's going on, they always feel comfortable that someone can speak to them in their language and better explain. It's like any other culture, right? With seniors that don't quite know English very well. And I'm happy to see now in the hospitals as well, like we do all have to take this Indigenous cultural courses now through our like Karna, or through our work, through our annual recertifications. They did bring an Indigenous program in, and everyone has to take it so they can better understand our culture in the health environment. Yes, it's even more intense, the physical heaviness of nursing, because with the COVID patients, they're very, very sick, of course. So you're always right there with them, doing many different tasks. The alarms are going on continuously for some. And then you're also proning them. So you're turning them on their tummies, their face down, so that they can get better lung expansion for air, because the ventilators are pushed to the maximum and they can't do any more, and the patient's still struggling. So we have to prone the patients, put them on their tummy. They're dead weight because they're sedated, because they're very sick, right? So they don't fight the ventilator. You have to keep them sedated and medicated. And so they're dead weight, and so you're flipping them, because you can only keep them on their prone position for so long, for only so many hours, and you have to put them back. And so it's kind of back and forth. So it's a lot of, and you have more people helping, of course, but because the ICUs are full, you're not only doing your patient, but you're also helping the other patients, as other nurses turn their patients as well. You have to work as a team.
What other hardships has COVID caused for you, for your community?
Yeah, for I guess with the it's just so hard because we're also being deployed into other areas like at the doors, making sure people are washing and wearing masks, and when they're leaving, like all the policies and protocols and then we get people coming in from off the streets and getting angry at us because we're at the door. We have to monitor and man their, make sure they've washed their hands, they put masks on, that they follow protocol. And so some of them don't like that and they'll just walk through. And so it is difficult in different areas. I mean, this year, I think people have a better understanding. But last year, when it first all came out, and we were helping and being pulled to different areas to help, like the officers, where you have to even watch the doctors coming out of the OR room, make sure that they're following the proper protocol and taking off every piece of item that they have to wear. And same with the nurses. So they have someone in charge of that, and you're monitoring, you're watching each one of them take off their mask, their goggles, we have to double cap in the OR. And so there's an order. And so we do have pictures on the walls as well, that if some people don't understand, they just follow the steps and what to take off first. Like you take off, the more, I guess, dirtier areas, like your gloves and then your gown, and then you go to the higher up where the cleaner areas, and you have to wash in between each item. So there's a lot of steps, and it takes time, so you can't quickly go in and out. So they redeploy us to different areas to help out.